r/Askreddit by Reddit and chill. Surgeons who work with amputating limbs. What was your worst OF moment? Surgeon here. Have a few stories. Called to the ED to evaluate a table saw injury to arm. Found a mid-forearm almost complete amputation hanging on by a skin bridge. We were able to reattach it and I think the patient has good muscle function but tenuous sensation back now. My intern year. Got a consult for a cyclist who was blindsided by a pickup truck. Entire leg was completely mangled. He arrived intubated and sedated with lots of other injuries. Dude never woke up. It was the first time I saw a leg filleted open from trauma. With exposed femur, also fractured. And multi-level open tib fib fracture. Just hanging out of the tissue in the ED. We amputated the leg at the shin and then femur while trying to save him. He died of massive kidney failure from muscle injury. Dead muscle protein clogs the kidneys like taking a big dump clogs your toilet. Kidneys failed causing liver to fail and then lungs fill with fluid means they can't ventilate. And cardiac issues follow from electrolyte abnormalities. No amount of existing technology can bring you back from that. Unfortunately, one of my worst cases was a patient with really bad sepsis from an infection. All the blood vessels in your extremities constrict. So amputating fingers isn't all that common. But this was catastrophic. As we ultimately had to amputate all 4 limbs. I'll never forget writing that op report. You list each procedure for these documents. And it went. 1. Amputation left arm. 2. Amputation right arm. 3. Amputation left leg. 4. Amputation right leg. Patient was a Family Guy fan and said their Halloween costume would be the pirate the following year. At least they didn't lose their sense of humor. Cause that was ultimately some funny shit. In reference to the cyclist. How do you emotionally process that? Maybe you get used to it but I feel like watching someone die a traumatic, unexpected death might be the end of my career because it would just be so sad. When the blood was green. A rare disease caused by overdose of migraine medicine. Suru he wasn't a Vulcan? This isn't 100% on point. But I think close enough and I think interesting. I'm now a head and neck surgeon. But during my trauma rotation as an intern we had an extremely inebriated guy come in who'd been hit by a car just outside of the party he'd been at and suffered a traumatic amputation. The accident knocked his leg off at the knee. So he's wheeled into the trauma gurney on a bed. And his leg is brought into the same room literally in a bucket of ice. The guy was super combative. Trying to push us around. And at one point literally yelled duck off. Let me walk it off. By my calculations he would have made it 1 step. 2 tops. Made it 1 step. 2 hops. Surgery resident here. The duck moment doesn't really happen in the OR. But can happen after. One consideration is always at what level do you need to amputate? The toe. A transmetatarsal. BKA or ACA. Below or above knee amputation. If you decide too much some sicker or more elderly patients may never regain mobility again. If you choose too little. The disease process. Infection or ischemia. Might not be controlled or won't heal and you end up going back for more. The realization you have to go back for more is the moment. The 24 hours after a tough case are the worst. You're wondering did you nail it or did you miss something somehow? I remove a lot of eyes. When training. I had a nasty one that I just couldn't grip with forceps while I was making the main cut in the optic nerve. I had to resort to gripping it with my fingers. As you are imagining. I made the cut. It shot through my fingers like a grape. Hit me in the chest. Rolled down my gown. Bounced off my foot and rolled about 10 feet on the floor. Leaving a bloody snail trail. It was a lunch break change so about 10 people were in the room switching over. I headed upstairs when I was done to join my preceptor in another case. He sees me walk in. Sees a bloody spot on my shoe cover and asks. You didn't drop the eye did you? My head just sank. I remove a lot of eyes. With a lead off like that. Goddamn. Agreed with the surgeon above that our training is so long detailed that we don't have these moments frequently. However, in residency I was doing a hemipelvectomy, essentially a removal of half of a patient's pelvis with or without removal of that leg, with my attending surgeon and we came to a crucial step. After a few hours of dissection and planning, we had made our cuts on the pelvis, basically planning and mapping out the portion we would remove. The time came for us to complete the cuts by levering out the half of the pelvis with our hands, which required a lot of force. After the levering, there was an audible crack, expected, but then the wound immediately filled with blood, unexpected. My training to that point told me to immediately pack the wound and hold pressure. My attending looked at me and said keep holding pressure, and then scrubbed out, took off his gown and gloves, and left the room. I'm now standing there over this young patient holding pressure with all my might so that my arms are shaking. I looked to anesthesia and his PA and asked what the hell was going on. Here I am single-handedly keeping this patient alive with no direction or immediate game plan about how to fix our problem. This was my oh duck moment. An eternity, it seemed, went by and my attending came back in. Scrubbed in. And we then methodically isolated the large bleeding vessels and tied them off, cauterized them. Afterwards I asked him what he was doing. He said over the years he had learned if he had a rise in anxiety from something unexpected, I guess his oh duck moments, he would take a breather, whether physically removing himself from the situation or not, to refocus and psyche himself up to fix the issue. This was one of my greatest learning moments of my career. That's kind of terrifying but also really reassuring. Surgeons mostly know what the hell they're doing. Taking a breather in those moments is so smart. Not a surgeon but a leg amputee. I was reading the notes from my surgery and the doctor stripped the screws when trying to remove the titanium plate that was holding my leg together. He had to call and back up. You'd be surprised how easy it is for that to happen. When screws have been in place for a long period of time, the bone tends to grow into the grooves, making stripping the screws quite easy. We even have a broken screw set that we use to remove screws once they're stripped. Not a surgeon, but I work in a facility that helps with rehabilitation of amputees and getting them walking again. I watch a resident go to stop a door from closing with his stump and it was like the world slowed down. From the moment I saw him move his stump to stop it, to the point of impact, I was screaming, oh duck, that's gonna hurt so bad. And it did. He looked at me and just cried. I pushed him back to his room and his wheelchair and he apologized profusely, saying that it's just instinct cause he had a leg there for so long. He ended up splitting the stitches back open and the infection that came after ended with him going from a mid-shin amputation to above the knee the next week. He was a great guy. He's walking and back to living his regular life again. Oh hell no. I'll never again complain about my instinct that made me catch a falling cactus. I work in the quality department for a large hospital system. We had a doc take off the right foot instead of the left. That was a lot of fun paperwork, as well as a lawsuit. Wrong side surgeries are surprisingly more common than you think. Wrong side amputation, however, is thankfully more rare. That's crazy. When I had my ACL repaired, I had to verify to practically everyone who walked in the room which knee it was, and the surgeon and I think maybe even the anesthesiologist, both had to sign the correct leg in Sharpie before they would even do the spinal block. I was first assisting on an emergent guillotine ankle disarticulation. You basically just rip and cut the foot off from the leg and leave the bones sticking out. I was providing traction on the intensely infected foot while the surgeon sliced through the remaining tendons holding it in place. When the last one snapped, I fell back, holding onto the now independent foot, squeezing a load of green pus out onto my chest. Was just thankful it hit the gown and not my exposed neck. Why do you leave the bones out? PS. When you said gown, I was picturing a very elegant dress. I'm not a surgeon, but I did rotate in surgery back in my med school days. My first day on surgery rotation, I was assigned to the trauma team. This was at a level 1 trauma center in an inner city hospital in NY. It just happened that on my first day, all the residents were in a meeting, so when the trauma surgeon needed an assistant, she asked me to join her for an emergency above knee amputation of about infected leg, wet gangrene in a very poorly controlled diabetic. So my first day on surgery, I'm in the OR holding this man's infected leg while the surgeon saws it off. After she's done, she literally squeezes out pus from the thigh. The odor was putrid. It's one of those smells that lingers for days. For the surgeon it was just another day. But for me it was definitely an oh duck moment. Edit. Removed extra S from pus. St. Barnabas in the Bronx. I rotated there about 10-12 years ago. The first surgery I saw as a nursing student was a toe removal. Poor patient had to have his big toe removed due to a diabetic ulcer that had gotten infected. I was so afraid of the thought of getting nauseous with my first surgery. I didn't eat breakfast that day. The case started at noon. I was wrapped in the sterile gown and mask hair cover/shoe covers. I was positioned by the circulating nurse in a spot with a great view but wouldn't get in the way. The case started and the doc started cauterizing bleeding veins capillaries right off the bat. I learned that cauterizing flesh smells a lot like searing steak. My empty stomach and hungry brain didn't know the difference. And I could hear my stomach growling at the smell. I thought it would be just my embarrassment. Until the surgeon and nurse both looked at me. They could hear it too. I'm not sure what I said. But I was glad my mask hid how I was struggling not to cry. It was awkward until the doc took the severed toe and tossed it over the patient and into the formalin container. He had great aim. I feel your pain. I was a nursing student watching a hysterectomy and the cauterization smelled like rotten McDonald's to me. Next thing I knew I was on a stretcher with a nurse rocking my bent knees back and forth and rubbing my head. I knew right then the all wasn't for me. I want a real surgeon to come and tell a story about when they locked their keys in the car or something. I'll try to oblige. General practitioner. About 10 years ago worked with a surgeon who moved to a new town and bought a new house plus 2/12 after graduation. Single. He wanted floor-to-ceiling linen curtains custom made for his living entertainment area. But was appalled at the cost. Never sewed in his life but thought how hard can it be to sew fabric when you sew people for a living? So he went to a fabric store. Bought some linen in a fabric he liked. Had the store cut it into the right lengths and then neatly hemmed all of them by hand using a variant of a subcutaneous technique usually used to close surgical wounds. It was very neat and took a very long time to finish. But it was his icebreaker whenever he invited people over for dinner for a really long time afterwards. As a med student I used a giggly saw to remove a dead leg from just above the knee from a man who was homeless and horribly diabetic. When it came off the surgeon said here. And handed it to me. Then he said take a picture. It's your first one. Like someone was gonna have me hold it like a fish I caught. He was joking. But I was freaked out and dropped it on the floor. Such a weird moment in my training. Or nurse here. Recently did a below the knee amputation. The leg was severed and I was passing it off to the circulating nurse for specimen. Went to take a clamp off a large artery and my poor co-worker got a big spray of blood. Felt terrible. Not related to amputation, cesarean section, but when I was a student midwife I managed to forget to attach the catheter bag to the tubing when catheterizing and I managed to get urine into the theater nurse's eye. I was not popular. I had to explain to the patient why we had to take bloods after the baby was born as part of the potential contamination protocol. She thought it was hilarious. Resident surgeon. Assisting on a below the knee amputation due to necrosis from diabetes. Leg was incredibly crusty with dead skin. Removed the leg. Handed it off to a tech to put into a box for disposal. Idaho Spuds cardboard box lined in plastic. Tech trips on his booty. Almost fell. But squeezed the leg so hard the inside popped out from the skin sock. It flew across the floor. Leaving a slug-like trail of pullulant slime as it skidded. We retched. We laughed. We moved on. Skin sock. Had a trauma case one time where the paramedics said a dog amputated a patient's foot. We were expecting them to be blowing it out of proportion and got ready for just a severe bite. Nope. We were wrong. Patient rolls in and the foot is almost completely off except a piece of skin holding it together. Turns out the dog must have been super pissed because it chomped right through. Nurse in an emergency department. Accidentally amputated a toe that was rotting in a boot when I pulled it off the patient's foot. There were many ducks said that evening. Does that count? Seems like the boot may carry the fault on that one. Read the case of an ED doc once who noted a patient's atrocious oral hygiene. Repeat homeless man. Asked to check his mouth. Expected masses or hell. holes into the mandible, and found the patient's teeth loose enough that several came out with the force of his finger sweeps. The rest of his story was the doc freaking out and consulting with hospital legal to make sure his accidental dentistry wouldn't come back as a lawsuit. Comment translation provided by u/cataclysmic here. Reddit.com link/Askreddit comment C2Y4JB surgeons who work with amputating limbs. What was F90 UX UTM source equals share and UTM medium equals IOSAP and UTM name equals IARTMF. Back in my trauma surgeon days, we had a pretty major fracture dislocation situation in a dude's right humerus with associated degloving. His brachial artery was tangled up in a bony mess, and we took him to theater overnight. We were there for 10 hours, the vascular consultant, the ortho consultant, and 2 registrar/residents, me and one other. We were ready to source graft, amputate, or ORIF, or XFix. The OT nurses probably hated us, because we had to maneuver everything while also having x-ray in the process. I'll be honest, we were physically and mentally exhausted by the end, and we thought we got away without amputation. But no dice. We had to take him for a relook the following night. Only problem was the vascular consultant was in theater dealing with a AAA. So you've got 3 ortho surgeons and a petrified vascular reg and this mangled arm. And it's not an anatomical arm like in the textbooks. Nothing is where you expect. Even though 3/4 were there the night before. You have to reprogram your muscle memory. The whole procedure was an ODUC moment. We had to remove all the metal we'd put in the night before, which keeping the arm stable enough to not rip the soft tissue so that the stump could be modeled healthily. It all went well, but many people were breaking themselves that night. I know some of those words. Ducking, like and subscribe.